The other thing that many medications do that your listeners really need to know about is
Mhm.
this concept called drug induced nutrient deficiency, which
Wow.
means when you have a medication on board, it can alter, use up, deplete nutrients that are critical. Or it can even affect the absorption of nutrients. So, a lot of the acid blocking drugs for reflux will block completely many of critical nutrients, which starves that cell more. So, as a pharmacist, I am critically looking at that. I do not want a medication to cause problems down the road if I can avoid it.
You're listening to Cold Press Conversations with Dr. Jewel White Williams, a lover of numbers, lists, and a good glass of cold pressed juice, who is sharing episodes each week to help you explore the back end of healthcare and health sciences. Where a lot of that grit is done, we'll dive into topics covering research, education, and clinical practices, as well as guest shows with other leaders in the field. Pull up a seat and let's dive into these amazing and game-changing conversations.
Hello, I am Dr. Jewel, and some people call me Dr. Williams, and I am elated to be here on Cold Press Conversations with Dr. Kathy Campbell. You know, Cold Press Conversations is here to help influence and help patients, caregivers, community health workers, and even our own medical professionals to learn and dive deep into what's actually happening in our communities. And that's the reason why I have Dr. Kathy Campbell on here today. And I think some of you are understanding as you watch this, and when you do watch this, that you will see that I do have a deep passion for pharmacy. And the reason I have it is because one of my, not the very first job, I'm not going to tell you about that one. That was kind of fun. But the second job that I attained beyond that was actually a W-2. I was working for a very local and a very popular pharmacy that is located in Rhode Island. And I'll leave it just that. And during my time of working in pharmacy, I had some amazing pharmacists that I worked with. I learned so much from them that I thought that being behind the scenes and hearing what they're doing and how they do what they're doing, and they explain the process of what they were doing. That was back in the day when we had a count, and now I think it's a little bit
Mm-hmm.
different. You can hit a button and it comes on out. So in that counting time, the slow part of it is when I learned about the process of what's happening in the field of pharmaceuticals and why they speak to the patient the way they speak to the patient. And that's the reason I wanted Dr. Kathy Campbell here today. But before I go any further, I've got to give you who she is. I think it's important that we highlight who she is. Now, I got to let y'all know, I'm excited because she is a TEDxTulsa 2018 speaker. And I have to say that. But she's also a clinical wellness pharmacist and innovator. She received her Bachelor of Science in Zoology and Pharmacy from the University of Oklahoma and a Doctor of Pharmacy as well. She's practicing clinical pharmacy in Oklahoma since 1992. Together with her husband, Dr. Campbell has owned and operated Medicap. Is it Owasos?
Mm-hmm. Mm-hmm.
Owasos Wellness Pharmacy and Compounding since 2001. Her serving of four generations of patients. Four generations. That's incredible. Has fostered a deep desire to support her community in being and aging well. A lifelong entrepreneur and problem solver, Dr. Kathy has responded to the cultural health crisis by creating innovative solutions for patients, employers, the pharmacy industry. And Dr. Kathy Weight Loss is an innovative pharmacy-led lifestyle and weight management program. And Dr. Kathy Health creates a delivery of products and services to support pharmacy-based health and wellness. And Dr. Kathy's Nourish is her newest initiative, which brings food is medicine, understanding to patients through nutritious foods, recipes, and pharmacy-led cooking demonstrations. In addition to a robust appointment-based clinical community practice, she is in demand to share her knowledge and vision through speaking, teaching engagements. And she presented in 2018, Obesity, the Modern Famine, during TEDxTulsa. In October 2019, she launched a continuing education course called Creating Health Pharmacist-Led Lifestyle and Weight Management management. She is nationally known as an advisor to industry and government regarding the community pharmacist's role in integrative health. And she is the new author in 2024 of her publication, Obesity, the Modern Famine. And she is a proud mom of two wonderful adults, Emma and Abby, and a Girl Scouts mom to many, creating a culture that produces health is Dr. Campbell. And she is devoted and she is on Cold Press Conversations. Welcome. Yay.
That makes me feel tired. I do it a lot.
I'm telling, well, I have to tell people what you're doing. Cause I
Yeah, I
mean, you
appreciate that.
are, and when I went to your website, I had the joy of seeing what you have. You've taken pharmacy to one level and then you took it to another level and then we took it to, because you're looking at the whole person. And I thought that was
Yeah.
really intriguing.
Yeah, I want to keep people from needing medications, and I like when you have 4 generations of patients that you've had the privilege to care for. I've known some of these people longer than I knew my mom. I do not want to get that call. And I started when I was 25, so I've been aging with them. And so in looking at aging well, I just noticed that the medications weren't giving me the results that I really wanted. And so that's when I
Mm,
went a much deeper dive into the biochemistry. I'm like, well, nobody has good foundational chemistry. Nobody's
mm,
culture, our culture is so disruptive and pretty toxic that we're living in an environment that makes it very difficult for the human species to really exist well.
mm,
And so, knowing that, I use my education and tools and my history to help them create a new culture, right, within their own lives. And,
mm,
in part of my history, and I say this in the TEDx, I've been obese my whole life. So I was 100 pounds at 5 in 1972 and 200 pounds at 10. I graduated 275 in the 80s. I had a 350-pound grandpa during the Great Depression. Okay. And
wow.
I just knew that it wasn't just about food. And so I took that personal study and that personal journey, plus a few degrees in biochemistry, basically, and created some solutions. And then I
Mm,
had patients who trusted me to help them and they'd implement the solutions, and we got great results. And again, it's all about us having great lives. I want you to have
mm,
a great life. I want to have one of those too. And I know health is foundational, right?
mm,
It's
mm.
not impossible to have a great life and not have good health, but man, it's a lot easier. So, health isn't a lot of medications. We've been kind of groomed to think that health is in the pill bottle or at the doctor's office. And the reality is, it's way before that. It's not needing those medications, is where I want to help people be.
That's one thing that really attracted me to what you're doing, because you are a pharmacist and we did have a little pre-discussion about the biochemical part, the biochemistry, understanding inorganic and organic chemistry, looking at the whole picture of everything. And you just finished talking about your own personal journey, but your journey with weight management, and you talked about how it influenced and shaped it. Do you think your approach will help shape future pharmacy professionals
I
in
hope
their process?
so. I hope so. That's part of my game. Um,
Mm,
so, part of my unique point of view is I'm also really like science. I'm excited about applied science that makes a difference for people. I'm a little geek that way. And I
love
can
it.
kind of see the mechanisms in my mind and all this other stuff. But I was always intrigued by nutritional science
Mm,
and evolutionary science. And I
mm,
never thought that zoology degree would give me an insight to some of these foundations. So I
wow.
would take that and I would read. I remember about 20 plus years ago, 25 years ago, I read about fish oils. You died less often if you were taking fish oils. I thought, well, that's interesting. I think we should tell people that. Or vitamin D. 25 years ago, I'm like, the research and my patients are coming back and they're all low in vitamin D when they are diagnosed with diabetes. And then they fix the vitamin D and their diabetes gets better. What's going on here? And so I
Ooh.
started looking at those nutrients, and then I dug into the science that I had had very little exposure to, but I knew how to go find a book and read about it. It's a lot easier now because you just go Google and
Right.
Khan Academy and you can review the mitochondria and all this stuff. And so I just started looking at science beyond pharmaceuticals, right? And I started asking the questions, well, why are we having dysfunction? What's going on? The fact that you need a medication, I want to know why. What's going on? And so when I started asking that question and then looking into the science for the answer, there was some answers there. And that's what I started counseling patients a little differently. It's like, how's your vitamin D? When I'm dispensing a medication and I can tell that they're having certain issues. Well, have you thought about this? Have you looked at this? Bring me your labs. I want to see what your cholesterol is doing. And I would do that as I'm counseling them about their medication, and they appreciated it, but it also impacted their health and well-being with most recommendations.
Wow. You know,
Yeah.
when you were talking about, and we're going to just go back to the weight part because
Mm-hmm.
there was something that I read. You said if obesity is a symptom and not the root cause, that's what you were talking about. Well, what would you suggest is the underlying health crisis? Because you made it very clear. Obesity is a symptom,
It
not the
is.
root cause. I'm telling you that. I like the way you said it because I'm like, hold a second. She just went deep. It's a
Yeah.
symptom. I think one thing that is important is that we talk about signs and symptoms. What is the symptom that someone has? Tell me, what is it
Mm-hmm.
that, how does it feel? Where is it? You're asking all these questions. And how does it make you feel? What is the level of it? So if it's a symptom and not the root cause, and I'm breaking it down for our listeners, because there's a difference. The definition is huge between the two.
Yeah. Yeah. And to be honest, medicine has done a terrible job looking at obesity as a symptom. Now, if you have an elevated temperature, that's a symptom of an underlying problem, right? They're going to look for an infection, they're going to look for this. But weight has not been perceived as such. Most of the time, weight is seen as a personal failing, and there's a lot of
Yes.
shame around that. But
Yes.
I started, first of all, I knew that personally because I knew what I was eating and I knew what this skinny person over here was eating, and there was two completely different outcomes. And I knew there was a genetic component, which there are. And I just happened to be the kind of genetics of a family that if there really was no food around, we'd live and they'd die. So it was okay. It's just part of it. But the environment was not conducive to my genetics per se. What is obesity a symptom of is a really good way to think about it. And about 10 or 15 years ago, I heard a lecture on diabetes, and the person giving the lecture made the comment that we know diabetes takes 15 years to happen. Okay. We know that there is chaos a brewing for 15 years that leads to the elevated sugar that we term as diabetes. And so when I heard that, I'm like, why are we waiting till you're 16?
Yeah.
And so I started looking at that research, and one of the signs of this progress is increasing insulin. Well, the effect of increasing insulin is weight gain, an
Okay.
increased waist to hip ratio, and elevated blood pressure. Now, we would see those way early, like, 10 years before. And so when I heard that, I think, well, I want to help people at that stage. I want to see if we can keep the diabetes from ever showing up. That's hard in our medical system because the doctors, the system, the insurance don't do anything unless there's a diagnosis. And
Yes.
so until you are sick, you will get no support or help or counsel from the doctor and the insurance system. And I
Mhm.
don't think people want that.
Mhm.
I don't personally think people want to be overweight or want to be sick. They just either don't have support, don't know what they don't know. And so my job has always been to facilitate people having the health they want to live the life they want. And I
Mhm.
think obesity is just one of those conditions that there are a lot of underlying drivers. And fundamentally, like I say in the book, obesity is a modern famine.
Mm.
We are starved at the cellular level of what our biochemistry is machinery needs to function. Okay. And actually, there's about 24 famines that I write about. But fundamentally, we don't have the chemistry for our bodies to work. Okay. And why? Well, recent study, 73%. This is one reason. It's not all of them,
Okay.
but it's
Okay.
one. 73% of all food produced in the United States is ultra processed food, ultra high processed food. 73%. So 3 out of 4 options will kill you versus help you biochemically.
Oh my
Those aren't
God.
very good odds.
No, they're not. One thing I do, I like to read the labels. And
Yes.
I'm gonna be honest with you. I'll share all my good foods that I have, the fun foods I like to have. But I really try to be very careful about what I put in. I really try. Now we all have our days. I'm like,
Yeah.
okay,
Yeah.
I love a good crunch. And somebody said, well, you can have a carrot. Well, the carrot's not gonna give me the same kind of crunch as
That
a
ain't
Cheeto.
cut it. Yeah. Yeah. Yeah.
And I know
Yep.
it's not. I know it's not a good thing. Okay. I'm not gonna sit here and say,
No.
oh, I do like my vegan food. I really do. But I do sometimes have beef, just to make sure I have certain vitamins in. But when I'm reading it, you're starting to see more bioengineered on the back of the foods, more
Mm-hmm.
and more and more and more. I know at one point they were concerned about the food coloring in the foods that we had that were supposed to be normal. Like they were actually
Right.
dyeing the foods. We're talking about even meat, to give it
Yeah.
that red look. So you're saying 73%. So that's a lot. That's a lot. And so
Yeah.
because you notice that when it hit the 90s, things started changing, or actually mid to late 70s, that's when things started changing, where you can even look at the photos of how people are when they're even walking in the movies or when they're
Mm-hmm.
with their pictures and stuff like that. You can actually see the people who are there, like you and me, and they are smaller. They're
Yeah.
smaller.
I really think the most catastrophic shift happened in the 80s. And that's with the advent of the Happy Meal and the drive-through.
Mm,
Because
mm,
with the Happy Meal or the kids' meal, all of a sudden, what humans were trained to eat from infancy on was non nutritive. So now we have kids' meals that are chicken nuggets and burgers and pizza and mac and cheese.
yeah, yeah.
That kids' meal is now what the adults want and fueled. Now, I love a good nugget as much as anybody, but it doesn't populate the mitochondria,
Yeah.
right? It's
Yeah.
not enough of the right nutrition, nutrients, biochemistry to actually generate energy at that fundamental level. That's part of the deficiency, but it was a catastrophic shift in what humans considered food. Now,
Mm,
the environment shifted so severely, I think that's part of why the dysfunction. And like I said, I don't see obesity as the problem. It is the problematic. It's problematic. Trust me, carrying around 150 pounds is not great. And it has its own burden. But the
mhm.
problem is we're in a society that's the appropriate byproduct of living in our society,
But they're saying it's
right?
going to increase though, too, Dr. Kathy, aren't they?
Mm-hmm. Yeah, and the only way to shift this is at this point that I found is individually. You have to be radical. You have to push back and actually do crazy, difficult things like cook. You might have to seek out vegetables. You might have to grow things. Those are really radical in our society when the standard way to eat is through a drive-through and through a microwave or processed food. And I coach people on that. I'm like, I need you to get mad. And most people come in mad at themselves. Like, I can't
Mhm.
do this and
Mhm.
I've tried
Mhm.
everything. And I'm like, no, don't get mad at you. We are in a environment that if you do nothing else, you will get sick and you will get overweight. Okay. It's
Mhm.
it's you living on a petri dish that is toxic, right?
Mhm.
But
Mhm.
the
Mhm.
opportunity is for you to understand that and to create a different environment or what I call a different culture. If you think about a petri dish, that medium is called a culture. And so I have people look at what are you living on? What is supporting you or disrupting you? And that's everything from the nutrition, the stress, purpose, friendship, connection, social networks. There's a lot of very well documented things that we need for our human species to function well.
Mm-hmm.
Other cultures do it way better. Okay. Our culture is very toxic. And as a result, we're very sick culture.
Yeah, I'm glad you brought that up. So my husband, he looked at my meals a day because I came home from work and I was like, I really want something tasty. I said, I don't have any spaghetti in the house, but I said, oh, I have some heart of palm. So they were already sliced. So let me cut it up.
Mm-hmm.
So I said, I'll boil the heart of palm a little bit. And then I said, you know what? That's okay. I have some green tomatoes, spinach, tomato base that is free of everything. And there are out there.
Mm-hmm.
I had
Mm-hmm.
to pay a little bit for it now. I'm not gonna lie to you. And I use my Mrs. Dash, which I'm not getting any endorsements, y'all, but this is what I do use, my spices. And I blended all that together, of course, and my husband looked, he said, oh my gosh. I said, well, I wanted to feel like I'm having vegetables on the side. So I baked some cauliflower and just added just a little bit there. And I said, I just wanted something to have that crunch because I told you I love a good crunch.
Right.
So it's
Right.
very difficult though. I'm gonna be honest with you. It's difficult. I like to cook. But because of the fast pace in which we are in, I understand why people don't want to cook. They're tired
Right.
when they get home. Some people have been
Right.
traveling for an hour, hour and a half, even though it was only a 30-minute ride home, but it's now an hour, hour and a half because of the traffic. It is just really, really a lot on them. And then they go home with maybe their 4 kids.
Yeah.
And and
Yeah.
they have the dog running around, their husband's coming in, or their mate
Mm-hmm.
is coming, their partner's coming in. And so they have so much that's going on there with them. So it's very difficult for them to decipher what it is that they need to do. And you even
It
talk
is.
about that. Like you say, what do you mean by deciphering the body's clues for better health? And you gave a few. Do you have like your list of what to decipher as our body clues? Because like I told you, I love my crunch. Some people like the salt, some people like the sweet, some people, that we all have that little thing.
Sure. I think the biggest strategy that I help patients with is figuring out their unique machine in
Mm,
their unique life because everybody's biochemically unique. And that's one of my frustrations with medicine is they have this standard of care, but there's no standard human. Even the biochemistry of each person is different, but then you place them in different environments
mhm,
and you have each person has difficult or easy cultures and socioeconomic and transgenerational stress. So all those things play in, and ultimately the practitioner can't fix it. But if you educate and support the individual as a partnership in their team, oh my gosh, they can do amazing things because they know their life. One of the most difficult lifestyles and cultures that I've had to help patients interrupt was that like of a long haul trucker. Okay.
wow.
So think about that life. Or, like you just said, a mom of 4 kids after having had to commute and all that stuff. So the solutions there are a little different for each as far as strategies. Okay.
Mhm,
Strategies to create a culture. And what I have patients look at is how their body is basically functioning. Okay. So I see health as function. Are you
mm,
functioning well? And you get to say what that is. And trust me, I won't see poor function on a CBC. A lab work, by the time a lab test is off, you're really sick. But your
mhm,
function would have given you clues way before. I'm not sleeping as well. Oh, I'm grumpy. Oh, my energy is down. Those are all functional adjustments. And so if I can teach you to pay attention,
mhm,
and tweak based on that earlier upstream, then we can prevent the onset of disease. So that's the first thing is I teach people to listen. And I tell patients as we move along and we try different things, the key is figuring out what works and what doesn't work for your
mhm,
unique machine. That is a trial and error. But each individual, when you really teach and empower an individual to do that, it's phenomenal. We look at those functional, we look at sleep, we look at gut function. I always
mhm,
tell people if you eat a great diet and you take a lot of good supplements, but your gut doesn't work, you didn't eat it. They did not get within the bloodstream. So a functioning gut is a critical thing. Again, sleep and cognition. How well is your brain working? Or is it slow? Is it happy? Is it sad? Those things are functional adjustments in the brain. Okay. And I think what runs the whole body is the mitochondria.
Wow.
Which
Okay.
is the cellular energy factory. Because if you don't make enough energy every day, all day, that is a crisis for the brain. Okay. And energy is produced in the mitochondria, which is in muscle.
Yes.
And so we have to get all those nutrients deep into those little factories for them to produce ATP or the energy molecule. And if you don't do that well, then the body has to adjust. And some of the adjustments are obesity, fatigue, sugar dysregulation, poor energy, grumpiness, depression, all those things I see as functional, appropriate adjustments of the body to keep you going, survival, right?
Yeah.
So I kind of think about all that, but then I help you just figure out, all right, how do we get enough in, right?
I love
And
it.
then
I
the other
love it.
thing as a pharmacist, the
Uh-huh.
medications that people are on are complicating the whole thing. Okay.
I know we're getting close to the end, but how do you work with their medication and help them with that change?
So I try to get everything working better. And what often can happen is I don't need the medication. So we've got to talk to the doctor about adjusting those things. Like when the blood
Okay.
pressure is going too low now, we've got to adjust those. But medications only work as an adjunct to diet and exercise. And when I kept seeing the medications not quite working well, it just occurred to me that we needed to work on the nutrient and the basic processes. The other thing that many medications do that your listeners really need to know about is
Mhm.
this concept called drug induced nutrient deficiency, which
Wow.
means when you have a medication on board, it can alter, use up, deplete nutrients that are critical. Or it can even affect the absorption of nutrients. So, a lot of the acid blocking drugs for reflux will block completely many of critical nutrients, which starves that cell more. So, as a pharmacist, I am critically looking at that. I do not want a medication to cause problems down the road if I can avoid it. And so I am very aggressive about looking at the nutrients that may be negatively affected by the drugs that if we support will help. So that's an
Wow.
important thing.
My name is Jules, so I use gems. You've dropped a lot of gems to our audience, and I just want to say thank you. I know our time has come to a close. I mean, I could go on forever with your questions because you have just given us so much wealth. When you even talked about, like you said, weight gain, waist to hip ratio, high blood pressure, those are signs we can think about prior to. It starts 15 years beforehand for the diabetes, mitochondrial cellular factor, dealing with how we're starving at the cellular level or drug induced nutrient deficiency, culture of toxicity that's here. You have given us so much. And that's, you gave me what I want my audience to hear. I'm so thankful for you, Dr. Kathy.
You're very welcome. Thanks for being on. And I will say, I go into each of those pretty in depth and at a very conversational level in the book. So the book is Obesity, the Modern Famine, and it's available on Amazon and all those places. And we just got an audiobook. But I talk in depth where people can really start seeing where in their machine they could see that this might be going on. So I encourage you to actually maybe look at that or reach out, holler at me. I'll be happy
I
to
was gonna
answer
say, you know what,
questions.
listeners, one thing that I'm working on is I'm getting some amazing guests who have books that I am actually on a backlog of reading, because the authors that I'm having on, those who are of professionalism and they've been vetted, they have their doctorates, they have their pharmacy, their books are learning lessons. I mean, we could actually have a lecture based off of everything that I've gotten today that Dr. Kathy has given to us. So the book is on the shelf. I just got to pull it out with the others because I told you I'm on a backlog of reading because I'm reading all of my guest books and I'm learning a plethora of information. And I just want to say thank you so much. You have helped our community, and that's what I wanted. And not only are you helping the community with your voice and being a TEDxTulsa 2018, you have also published a book that is going to help us make better choices and at least seek assistance so that we can make ourselves better. Because as you stated, unfortunately, we are in a society that is just different from it was in the past. The 20th century is vastly different from the 21st century. We are advancing, and even though we're advancing, the advancements and some of the advancements have been detrimental to us from a nutritional side. And that's where Dr. Kathy comes in. I just want to say thank you so much.
You're so welcome. Thank you for your generous acknowledgement. I appreciate
Oh,
that.
no problem. Did you want to leave one nugget with our fams?
We live in a culture that is challenging, like you said. And I think as much as the nutrition is challenging and we can address that, we're humans. And we have to remember that we are animals that are designed to be connected. And the most powerful chemistry we have to facilitate health is first love, and second is food. And so I love that you're bringing people together on this platform, but seek out. And the worst thing for your health is being alone.
Oh, yeah.
And so we are still humans that need humans. Even with this digital craziness that is advancing way faster than I'm capable of dealing with, the reality is your body and your spirit and your mind works best when it's connected with other humans and when we eat enough nutrition. And so attacking those two things and really seeking to support that will do amazing things for health.
Oh, I love it. Thank you so much. I just want to say thank you very much for just being tuned in and enjoying this engaging discussion that Dr. Kathy and I had. We're going to continue to focus on the various topics that matter in our lives and in our communities and beyond. Until next time, this is Dr. Jewel. I'm signing off, and I want you to take care. And I want you to remember that knowledge is power when it comes to your health, but more importantly, that this is for your health and for your cognitive happiness. Y'all take care.
I hope you enjoyed this episode of Cold Press Conversations. If you love this episode as much as I did, I need you to head on over and subscribe so you never miss an episode. This is Dr. Jewel signing off to health and cognitive happiness.